Hi guys, Merry Christmas. This is Dr. Jonas Apostol. So I will be discussing this very interesting patient. So she's in her mid-30s and she went to the clinic with multiple dental problems. So the first problem, decayed multiple teeth on the front. Not just cavities but big cavities. We're talking about chronic apical periodontitis. It affects the pulp and extended up until the periapical portion of the teeth. It's 6 teeth that are affected. We did first a root canal treatment, so I referred the patient to our endodontist to treat the case. So with her case, it's a very tricky one because she has this very prominent na 2 teeth, no? Yung central incisor, yung bunny-ish, which bagay actually sa face niya. And a little bit off midline, like around 1.5 to 2 millimeter. So we were able to check on that as well. The asymmetrical profile of the teeth is very apparent. So the discoloration is very obvious also. When the patient smiles, you would be able to notice that there's a very different shades in her teeth. Iba-iba yung color niya. There's problem with the bite, obviously. So in this procedure, we have to incorporate equilibration, we have to incorporate a pathology, and the occlusion should be on point. Having this old restoration, yung mga composite direct veneers. Sa case kasi nito, I don't really think that veneers is the best solution for her case. It's because of the massive damage of the teeth. So before we start the preparation of the teeth, I did the smile design first directly using composite to make sure that the length, the height should be perfect at saka magustuhan ng pasyente, because we will pattern the final to the design that I make. So we make sure that it should be healthy by removing all the cavities and all the unsound structure. So for this case, we did an 8-unit crowns. Hindi na siya veneers, it's purely crowns. Number 1, it's root canal treated. Number 2, the damage is too big. So it requires stability, durability, and also aesthetics. I actually love doing veneers, but if the case is not for veneers, if it's not indicated for veneers, then we have to make sure that we give the best treatment, no? Which is, in this case, again, it's a crown. A jacket crown is dental restoration which encapsulate all the walls, not just the front but also all the sides and back portion of the teeth. That actually requires after a root canal treatment na procedure, especially if the damage is too huge. So I explained thoroughly to the patient about the treatment that will be done for her case. So she agreed, but there's a little bit of fear on her part. It's because it's crown. A lot of you may know that the crown is not like a natural looking, the usual thing, no, na crown na nakikita nyo. So yun yung fear niya na baka magmukha siyang crown talaga. But I assured the patient that it would look natural. So I'm gonna do an apostolified smile transformation, which is natural looking, balanced, healthy, also very beautiful, using a porcelain fused to zirconia. With her case kasi, it should be very, very natural looking, and it should be in harmony palagi sa face niya, sa eyes, personality, and also with other adjacent teeth, no? So this is an A1 shade, but in an A1 shade, you have to incorporate all the details na kailangan, like the staining, the natural subtle color that makes the teeth looks really natural. So yun. It's not just A1, but there's a shade of A2, a little bit of P1 there, and translucency.
1 week later.
We did a trying. Okay? So we make sure that we try in everything first. If it's fit, perfectly fit, hindi siya mataas or hindi siya walang mga undercuts and all, walang mga cement na dati na temporaries. So pag perfect na yon, and then the design is also perfect, so that's a time na isi-cement na namin siya permanently. Usually the procedure will be at least an hour under local anesthesia. An hour because we have to clean everything after. We make sure that all the debris must be removed. It should be flossable.
A few moments later.
So here it is.
Wow!
An 8-unit porcelain fused to zirconia crowns. So very natural looking. As you can see, it's not like your ordinary crowns. It's an apostolified smile, which very healthy, very durable, and very beautiful. The gums is healthy. Also, as you can see, the symmetry, the balance is there. As you can notice that the canine are a little bit prominent as patient requested for that. Also, the lips adjusted na. So as what I have mentioned, very important that the lips should be in harmony with the teeth. Kasi we don't want to give like a bulky, make sure na balanced talaga siya. So the patient had a fear before na it might look fake, but this time wala kasi nakita niya yung result. So I'm so happy for her. So after a week, patient went to the clinic again for night guard and also cleaning. So when I checked the case, yung gums mas maganda na. Tapos super linis kasi she can be able to floss it properly with no problems at all. And yun, we did a little bit of equilibration. So yung next project namin is lower naman. So there are no shortcuts in dentistry. We have to make sure that the health is at the top priority. And as a dentist, it's my obligation to make sure that it is functional. And as a cosmetic dentist, it should be beautiful. So that is the meaning of an apostolified smile. Merry Christmas.